Welcome back. This is Lawson ASP Med Simplified Hub, where we turn confusion into clarity. Today's topic is loop diuretics pharmacology. We are going to be talking about loop diuretics, example furosemide, how they cause ototoxicity as one of their side effects, one of their major side effects, how they cause ototoxicity. Now, what is loop diuretics? Loop diuretics is an anti-hypertensive drug, just like the Tizer diuretic, osmotic diuretic, and other stuff. What they do is what? They lower your BP. That's their major function. Loop diuretics can be given to patients suffering from hypertension, heart failure, or pulmonary edema. And then they are more potent than what? Thiazide diuretics. And then we are going to know why they are more potent than that. So now, what is the mechanism of action of loop diuretics? What they do is that what? They act on the what? On the loop of Henle, just as the name suggests, the loop of Henle. So they act on the loop of Henle. Which part of the loop of Henle? The thick ascending limb, in short, TAL. So they act on the thick ascending limb, this particular part of the what? Of the loop of Henle. Sometimes they even work on the distal convoluted tubule. So they act on the thick ascending limb of what? The loop of Henle. When they act on that, what do? Absorption of sodium and chlorine happens there. And we know that wherever sodium is going, water follows. So water and sodium can be absorbed there. But what loop diuretics does is that they prevent the reabsorption of what? Sodium and chlorine. By so doing, they cause the excretion of what? Sodium and chlorine along with what? Water, thereby reducing the blood volume, thereby reducing what? BP or the blood pressure. So what they do is what? They inhibit the reabsorption of sodium ion and chlorine ion in the TAL. That's the thick ascending limb of what? The loop of Henle. Other ions are also inhibited from reabsorption. Example like calcium ion. So another side effect can be hypocalcemia. What was the name? Potassium ion. Another side effect could be hypokalemia. Magnesium ion. Another side effect could be hypomagnesemia. So almost all the ions are inhibited there. How do they inhibit or prevent the reabsorption of what? Sodium ion and chlorine ion. Now, in the thick ascending limb of the loop of Henle, we have a co-transporter called the what? Sodium, potassium, chlorine co-transporter. This is what aid in the absorption of what? Sodium, potassium, and chlorine in the thick ascending limb of what? The loop of Henle. But when this is what? Inhibited by what? Loop diuretics, there will not be any reabsorption. Thereby, all of them will be excreted. And they will force other ions to also be excreted because they will force other ions to also be excreted. Now, how does this cause ototoxicity? First of all, what is ototoxicity? It's the toxicity of what? In the ear, which lead to what? Hearing impairment. Hearing impairment. It leads to hearing impairment. Now, how? The co-transporter that we are talking about, the sodium potassium chlorine co-transporter, is present in the inner ear. This transporter is present where? In the inner ear. Which part of the inner ear? The stria vascularis. It's present in the stria vascularis of the inner ear. So what happens is that this drug, loop diuretics, example furosemide or torsemide, they go to the ear, the inner ear, and what inhibit this what co-transporter. What's the function of this co-transporter? This co-transporter basically helps in what? In modeling the fluid, the endolymph. That helps in what? Hearing. So when this co-transporter is what? Damaged or like is inhibited, what happens is that what? The iconic composition, how the endolymph will look like in order to help in hearing, it will not look like that. The composition will be distorted. And that leads to what? Ototoxicity. Ototoxicity. So this is how loop diuretics causes what? Ototoxicity. Make sure you understand it. Don't memorize it. Like, share, comment if this is helpful. Thank you.